dear postgraduates. So today's talk will be on alcoholism. Okay. So this is a very, very important topic for 4 reasons. One is for personal reasons. Number 2 for your professional reasons. Number 3 for your family. And the 4th one is the society. So alcoholism affects not only the person, but also his profession, family, and also the society. Rajesh. See, the alcohol is a drug, a chemical substance that is taken to cause the changes in the person's bodies and also the behavior. So it changes the body and also the behavior. It's a depressant. Most of the time it's a depressant. A drug that slows down the central nervous system. If too much is consumed, the vital functions may be affected that could lead to the coma or the death. It's a prodrug. It's a produced through a process known as the fermentation. Yeast feed on the sugars from the malt, grapes, or the berries. The byproduct of this is carbon dioxide and alcohol. So alcohol is nothing but people who can no longer control their use of the alcohol. Physically and psychologically, the body requires alcohol to function. So without the alcohol, they can't do anything. And psychological also, it's a drinking is an essential part of coping with the life. Alcohol changes a lot of the changes in the brain, in your frontal gyrus, or in the amygdala, in the medulla oblongata, in the cerebellum, in the frontal lobes, prefrontal, cerebral cortex. So everywhere it acts deleterious effects on the brain. So leads to a lot of the changes. And the tolerance builds, drinker needs larger quantities to get the desired effect. So in the initial days, he gets the desired effect with some amount of the alcohol. And as days goes on, he requires more and more alcohol. So that is the tolerance. And finally, he depends on alcoholism, that is the dependence. So this is the blood alcohol concentration. Amount of the alcohol in the person's blood. 0.08 is the legal limit to drive. 4 factors that affect the blood alcohol concentration. They are the rate of the consumption. So the more the consumption, definitely the more the blood alcohol concentration. And the girls and the women, so they need a lower amount of the alcohol to get the higher the blood alcohol concentration. The body size depends, and also the food in the stomach. So the more the food, obviously the less the alcohol concentration. So these are the different effects on the function depending on the blood alcohol concentrations. If it is a 0.01%, 0.1%, the motor coordination is impaired. 0.2%, obviously intoxicated. 0.3%, physical and mental activity decreases. 0.35%, anesthesia is present. 0.4%, respiratory drive is critically affected, and some people die because of the respiratory paralysis. And 0.6%, most of the people they die. So the de-addiction is the need of the hour. It's a major socio-economic and the health problem in India. A lot of the people, you need not remember these millions and the crores. A lot of the people, they die every year due to the use of the alcohol. So what are all the diseases caused by the alcohol, you all know better. And 3.5% of the global burden of the disease is attributable to the alcohol. Indian scenario. India tops all other developing countries in alcohol consumption. Estimated usage is nearly 62.5 millions. Age of the initiation of consumption has declined. Earlier it was average is the 30 years. Now it is 19 years. I think in Godavari districts maybe 12 years or 13 years. Even when they are 9th standard, the 10th standard, they start alcoholism. So now it has come down to maybe 15 or 16 years. And more women have started consuming. Kerala accounts the highest per capita consumption, followed by the Maharashtra and the Punjab. That was an old slide. Now it is not the Kerala. 8.3 liters of alcohol is consumed per person per year, according to the 2008 report, but now it is about 13.8 liters. Alcohol-related problems account for over a fifth of the hospital admissions in our country. So this is the current data. Currently, alcohol consumption in India has seen various trends across the states and different age groups. Arunachal Pradesh has the highest proportion for both men and the women who drink alcohol in Arunachal Pradesh. Among the women, Sikkim follows with a 16% alcohol consumption after Arunachal Pradesh. For men, Telangana is the number one with 43% alcohol consumption. Other states, Assam, Jharkhand, Chhattisgarh and Odisha, Lakshadweep has the lowest alcohol consumption by 0.4%. Consumption is higher in the rural India compared to the urban India, but now almost the rural India is all rural and urban is not of much difference in Godavari districts, so both are the same. 1% of the women aged 15 and over drink alcohol, while 19% of the men in the age group they do so. And this is more in the scheduled tribes and the religious groups. 6% among the women and 33% among the men in STs. Among the religious groups, other religions have the highest proportion of male drinkers. Here, other religions means most probably Muslims, I think, followed by the Hindus and the Christians and others. Alcohol affects on the behavior also. It causes the impaired judgment and loss of self-control. It decreases the person's natural fears. People may become violent, less self-control on sexual situations, less likely to use the other contraceptive measures. Some people act foolish and silly also. A period of the time a drinker can't recall, their brain loses the ability to make the memories, and person may unknowingly hurt themselves or the others. So suicides and homicides, they are also very common in alcoholism. How does alcohol use impact the mental health? Alcohol affects your brain, making you feel relaxed in a small amount of the time. As you drink more, you become intoxicated and unsteady, and you might do or say things you normally wouldn't. People with depression and anxiety might use alcohol to help ease the symptoms, but excessive alcohol use can also worsen your mental health. So finally, in the initial days, it looks like a euphoric drug, but definitely it causes a lot of the harm to the entire body and also his society. Sometimes individuals drink alcohol to cope with the stress, anxiety or the depression. While it may provide temporary relief, the calming effects wears off and it can actually exacerbate the depression symptoms. Hangovers, post-alcohol anxiety and depression, they are very common side effects. Long-term alcohol misuse can lead to serious health issues, including the liver diseases, your cirrhosis, heart diseases, your ischemic cardiomyopathy or dilated cardiomyopathy, and then the arrhythmias or the heart failures, and even the permanent changes to the brain, that is your encephalopathy, etc. Seeking professional help is crucial for managing the mental health effectively. How can a family involvement enhance the alcoholism treatment? So it has a supporting system, education, communication, relapse prevention, and healing relationships. So these are all will come from the family. So the family involvement varies, but it can significantly enhance the recovery outcomes. Here is a good patient, acknowledges the illness and need for the treatment, seeks out the medical care appropriately, communicates clearly and transparently with the healthcare provider, complies with the treatment, so good compliance, he responds to the treatment and goes away. So unfortunately, such type of the people are very, very, very few. So most of the people are deny their illness, use of the precious medical resources, can't be reasoned with, they do not comply with the treatment, unruly, agitated, uncooperative and ungrateful, refuse potentially life-saving care, and they keep coming back. So these are the different parts in the brain affected by the alcohol. So the cingulate gyrus, frontal lobe, precentral gyrus, central sulcus, postcentral gyrus, parietal lobes, your occipital lobe, cerebellum, medulla, temporal lobe, spinal cord. So all these things are involved in the excess alcoholism. So alcoholics sleep on the park benches and wear the shabby clothes. That is a big myth because fact is alcoholics comes from all cultures, from all backgrounds and all levels of education. Maybe IIT or Polytechnic or medical or engineering or law or even in the civil services, etc. So the writing, in what ways does the media contribute to this myth about the alcoholics? How else does the media shape people's perception of the alcoholics? So long-term alcohol abuse may harm the brain, liver, heart, digestive system, including the pancreas. Drinking may amount of alcohol during the pregnancy may permanently harm the developing baby. Nowadays, the pregnancy alcoholism, so causing a lot of the fatal syndromes. So long-term abuse destroys nerve cells in the brain. They can't grow again. Loss of many nerve cells causes the permanent changes that impair the memory, ability to concentrate, and ability to make the sound judgments. So these all will be paralyzed or depressed in alcoholism. And this is the most worrisome, is the fatal alcohol syndrome. It's a group of the birth defects caused by the effects of the alcohol on the unborn child. Babies born with this syndrome may suffer from heart problems, malformed faces, delayed growth, poor motor development, and mental retardation, brain and behavior problems. So even a small amounts of the alcohol consumed during the pregnancy can cause a lot of the damages to the fetus. So heart defects, malformed faces, delayed growth, poor motor development, mental retardation, and brain and behavioral problems are very, very common. Alcohol interferes with the liver's ability to metabolize or break down the. So the fat-filled liver cells die, leaving behind the useless scar tissue, that is your nodular formation, your fibrosis, your cirrhosis. This is the healthy liver and the liver damaged by the cirrhosis. Excessive drinking contributes to the heart diseases. Our alcohol causes increased blood pressure, hypertension, tachycardia, arrhythmias, and build up the fatty deposits in the heart muscle, that is our atherosclerosis, ischemic heart disease, and finally the heart failure also. Ongoing drinking irritates the tissues that line the digestive system. Repeated irritation increases the risk of the cancers of the mouth, tongue, esophagus, stomach, colon, breast, uterus. These are all very, very common cancers associated with the alcoholism. So, and recurring diarrhea, malabsorption syndromes, vitamin deficiencies. So these are also very common with alcoholism. People who can no longer control their use of alcohol suffer from this disease is known as the alcoholism. An alcoholic's body requires alcohol to function. He requires more and more alcohol. Alcohol is considered drinking a regular essential part of coping with the daily life. So without alcohol, they can't move, they can't live. Tolerance causes the drinker's body to need increasingly larger amounts of the alcohol to achieve the original effect, that is the tolerance. And finally, the dependence. The brain develops a chemical need for alcohol and can't function normally without an alcohol. So and finally, the addiction results. So the drinker no longer has control over his or her drinking. So it's all about the increased tolerance, dependence, and then the addiction. Anyone who drinks even one drink is at risk of becoming an alcoholic. So always know, all people, they start with only half drink or maybe very few ml of the alcohol in the beginning, but later they move on going to take the laters and laters of the alcohol. So alcoholism is 4 to 5 times more common among the children of alcoholics than in the general population. So alcoholism also runs in families. So a strong family history is there. I have known a lot of the families who ruined their lives with alcoholism. So grandfather is an alcoholic, father is an alcoholic, and he himself is an alcoholic. Now his kids are also becoming the alcoholic. So alcoholism may runs in the families. So underage drinking also increases a person's risk of becoming an alcoholic. So this is more common nowadays in India, especially in our Godavari districts. underage, even at the age of 10 years, 9 years, 11 years, 12 years, they are starting alcoholism. See the brain. So how it appears. A 15-year-old non-drinker on the left side, on the right side, it is a heavier drinker, not a regular drinker, heavier drinker. So almost a dependent on the alcohol, even at the age of 15 years. So what begins as a problem drinking becomes an absolute dependence and finally late stage alcoholism. Stage 1 is a problem drinking. If social drinkers start to use alcohol to try to relieve the stress or escape from the problems, their drinking habit may quickly become a problem. Then the absolute dependence. So the drinker can't stop after one drink and feels a constant need to the drink. So that is your dependence. And finally, the late stage, they rapidly lose their mental, emotional, and physical health. Late stage alcoholics also express reverse tolerance for alcohol, a condition in which less and less alcohol causes intoxication. So even if they take the less alcohol, so they become the intoxicated. So that is the reverse tolerance. So effects of the alcohol on the family. So because of his unpredictable behavior, embarrassment among the family members, violence in the family, negligence, financial problems, legal problems, and finally the divorce. So these are all the effects of the alcoholism in the family. Alcoholics can lead the productive, happy lives if they stop drinking completely. So that's the de-addiction. There are 3 stages in the alcoholic's recovery. So first they have to acknowledge the problem. So they should know that the alcoholism is a big problem for himself and his family and to the society. And then he should involve in the detoxification management and finally the rehabilitation. Alcoholics must acknowledge their problem and ask for the help. The shock of losing a job or being arrested or being separated from their families because of the divorce motivates some alcoholics to enter a treatment program. So they want to change their lives. They want to start a new life. So detoxification involves removing all alcohol from a person's body. Withdrawal is a group of the symptoms that occur when a dependent person stops taking a drug. So a lot of the people we see in the casualty or in the emergency rooms with the withdrawal symptoms, alcohol withdrawal symptoms, delirium tremens, some convulsions. Okay, so these are a lot of the situations we see in the casualties with the alcohol withdrawal symptoms. They include shakiness, sleep problems, irritability, rapid heartbeat, sweating. Rehabilitation is the process of learning to cope with everybody every day, living without alcohol. That is the rehabilitation. It's a teamwork. During the rehabilitation, alcoholics receive the counseling and may take the medications. So there are all the long-term risk of the alcohol, brain damage. Long-term alcohol use destroys the nerves within the brain. More of a negative impact on the teens whose brains are still developing. Permanent impairment of the memory, problem-solving skills and the judgment. Increases Alzheimer's or the dementia later in the life. So these cases we are seeing a lot of in our elderly population. See the dementia and Alzheimer's. Alcohol may shrink the critical regions of the brain. I have shown you the different parts in the brain which are being affected by the alcohol. Almost every part in the brain being affected by the alcohol. See the pictures here. A 48-year-old alcoholic woman. MRA 7 months later, MRA 1 month later drinking. So these are all the continued drinking and abstinence of the over the 1 year. So there are chances of recovery from all the changes that occurred during the alcoholism may come to the normal if they are abstinent from the alcohol for many years. This is the fetal alcohol syndrome. 1 in 10 pregnant women reports the alcohol use. A group of the birth defects caused from the effects of the alcohol on an unborn child. Already I told you these what are all the changes that occur in the child, the heart defects, malformed, delayed growth, etc. So you are pretty well that liver damage is very common in alcoholism, alcoholic fatty liver, steatohepatitis, and then the fibrosis, then the cirrhosis, and some people they may turn into the hepatocellular carcinoma also. So cirrhosis is nothing but a useless scar tissue in the liver that may lead to the liver failure and the death. So you will have an acute hepatitis, acute hepatic failure. Some people may have an acute and the chronic liver failure. So these are the very, very common. So comes with jaundice, elevated your SGPT, SGOT, alkaline phosphatase, GGT, etc. And heart problems are very, very common in alcoholics. First is hypertension, and then there will be the tachycardia, tachyarrhythmias, and then the fatty deposits in the heart muscle, that is your atherosclerosis or your dilated cardiomyopathies. They will increase the risk of developing the heart problems. Digestive system. Almost all the parts in the digestive system being affected by the alcohol, starting from your mouth. So carcinoma of the oral cavity is very common in alcoholics. Fungal infections, or fatal candidiasis, oral candidiasis is very common in chronic alcoholics. Aspiration pneumonias are very common. And malignancies in the throat, in the pharynx are very common in the alcoholics. And then your GERD, gastroesophageal reflux disease, esophagitis, gastritis, acute alcoholic gastritis, or duodenitis, acute gastric ulcers. So these are very common there. And in the small intestine and the large intestines, you will have the malabsorption syndromes, and also your colitis, amoebic dysentery or mixed dysenteries. So these are all very, very common here. The repeated alcohol consumption irritates the tissue within the digestive system, increasing the risk of the cancers of the tongue, mouth, esophagus, and the stomach. So alcoholic diarrhea, alcoholic indigestion, and then the different ulcers or the either in the esophagus or in the stomach or the duodenum or the small intestine, or even in the large intestines also. Acute intoxication, the people will go up with the hypoglycemia because they skip eating food. They keep on taking the alcohol, so that alcohol numbs the liver in doing the neogluconization. So finally the people will turn up into the hypoglycemia. And unrecognized hypoglycemia, so definitely there will be a death because of the hypoglycemia caused by the severe alcoholism. Alcoholic liver disease, hepatic encephalopathy, duodenal ulcers, accident proneness resulting in the brain injuries, spine injuries, several fractures. So very high number of the fractures we see on the 31st night or in the festival days because of the alcoholism causing the roadside accidents leading to the neurosurgical or surgical or orthopedics or spine, etc. So the alcohol also increases your dyslipidemia, your hypertriglyceridemia, elevated LDL levels. Even though the small amounts of the alcohol will increase the HDL, but the chronic alcoholics, definitely there will be the big dyslipidemia picture will be there. And of course, cardiomyopathies. So effects on the kidneys also because of the alcoholism. See the exposure in the alcohol in the brain. Medical disorders due to alcohol, deliberate self-harm. Okay, high risk sexual behavior. HIV infections are very common in alcoholics. Hep B is very common in alcoholics. Hep C is very common in alcoholics. And then the drug addicts are very common in alcoholisms. So tuberculosis is very common in alcoholism. Not only the tuberculosis, other opportunistic infections. So your pneumonias or skin and subcutaneous infections, urinary tract infections, gastrointestinal infections. So you name any organism. They're very, very common in alcoholic individuals. And the muscles, shrinking of the muscles. So because of the proteolysis, so they don't eat, so there won't be any protein genesis, so there will be proteolysis. In the skin, the redness, flushing, increased sweating. By seeing the face also we can say whether the fellow is an alcoholic or not. By skin, by the parotid enlargements, etc. So brain, the brain damage, memory loss, confusion, hallucinations, delusions, etc. And the pancreas, your acute pancreatitis, alcoholic pancreatitis, your amylase will be elevated, lipase will be elevated. And sexual organs, so definitely they will be lead to infertility, shrinking of the testes in the males, impotence, and oligospermia. Nose, broadening of the nose. Female sex organs, there will be increased risk of gynecological problems, harm to unborn babies. Lungs, already told you, aspiration pneumonia, or increase the chances of the infections like your tuberculosis, pneumonias, etc. In the stomach, bleeding, so GERD and also the bleeds. Intestines and ulcers and inflammations. Not only these body diseases, so the psychiatric disturbances, so something concerned with your mind. So there won't be any mindfulness in the alcoholics. So they lead to the mood disorders. So the depression is a very, very common, about 40% people. And the phobias, different phobias, generalized anxiety disorder, panic, antisocial personality disorder, alcoholic dementia, amnestic disorders, sleep disorders, and personal and social dysfunctions. See, these are all very, very common psychiatric disorders due to the alcoholism. So most of our people will have lot of these things like anxiety. Lot of the people will have the anxiety, depression, phobia, panic, personality disorders, dementias, so sleep disorders. So they are very common in alcoholic individuals. So the treating alcoholism, the 3 stages in alcoholism recovery. So one, acknowledge the problem, detoxification, so removing all alcohol from the person's body, and then the rehabilitation, the process of learning to cope with everyday life without the alcohol. It's very, very difficult in alcoholism to become a de-addiction. So it needs a lot of the teamwork and good cooperation between you people and the psychological counselors and then the psychiatrists and then the other people. And nursing care is very important. Family support is very important. So these are all very important ingredients to make them fully aware of the treatment of the alcoholism. How can alcoholism be treated? See, the treatment, detoxification, already I told you, the behavioral therapy, cognitive behavioral therapy, motivational enhancement therapy, peer groups, so group reviews, etc. And 12-step felicitation. And then some medications layer, naltrexone, acamprostate, disulfiram, benzodiazepines, and then your alcoholic smart recovery, lifestyle changes, healthy diet, good exercise, avoiding the triggers especially, and building a support network. So these things will make these people not to indulge in alcoholism. Interventions aimed at managing the acute intoxication and withdrawal in order to clear the toxins from body and minimize the physical harm from the substance use. That is the detoxification. So a lot of the stages of the intoxication is there. Maybe emotional instability, and then the confusion. So it's a 0.1%, it's an irritable. At about 0.2% emotional instability, at 0.3% of the blood alcohol, there is a confusion starts. At 0.4% the stoporose and the comatose, and at 0.5 or the 6, most of the people they die. So what are all the withdrawal, alcoholic withdrawal? The diagnostic criteria: cessation of or reduction of the alcohol use that has been heavy and prolonged. 2 or more of the following developing within the several hours to a few days later. Maybe autonomic hyperactivity like sweating, tachycardia, increased hand tremors, insomnia, nausea and the vomitings, a transient visual, or tactile or auditory hallucinations, psychomotor agitation, anxiety, and the seizures. So some people may be the tonic-clonic seizures also. Now no more use the word grand mal, maybe tonic-clonic seizures is the new word. So these are all the diagnostic criteria of the alcoholic withdrawal syndrome. So whenever you see a fellow with this sweating, tachycardia, tremors, insomnia, nausea, vomiting, okay, some hallucinations, psychomotor agitation, so obviously we are dealing a case of the alcoholic withdrawal symptoms. Symptoms cause clinically significant distress or impairment in the social, occupational, or other important areas of the functioning. Symptoms are not due to a general medical condition or another mental disorder. So you have to rule out the other conditions which cause all these things. Then only you can decide as an alcohol withdrawal syndrome. So here the GABA and NMDA, N-methyl D-aspartate. So GABA, you know that gamma aminobutyric acid is a major inhibitory neurotransmitter. Okay, chronic alcoholic exposure, they decrease in the GABA. So it's a major inhibitory neurotransmitter. NMDA is a major excitatory neurotransmitter. A chronic alcoholic exposure, increase in the NMDA receptor concentration, neuron hyperexcitability. So on one hand, you have the intoxication. On the other hand, you have the withdrawal. So what will happen to your GABA, your epinephrine, your glutamic acid, serotonin, dopamine? So they are all your good hormones. So dopamine, serotonin, endorphins, etc. See, intoxication is different from the withdrawal. So intoxication, what happens to your GABA? So GABA will be elevated, whereas in withdrawal, it will be depressed. Epinephrine, elevated intoxication, much more elevated in the withdrawal. So in all withdrawal people, they are tachycardia, they are hypertensive, they are agitated. L-glutamic acid reduced in intoxication because of memory disruption, whereas it is elevated in withdrawal with the delirium and the seizures. Serotonin, elevated intoxication, sedation and euphoria. Whereas serotonin is reduced in the withdrawals, there will be the mood disorders or insomnias. Dopamine is elevated in intoxication, mood elevation, and reduced, that is the mood depression. So these are very, very important neurotransmitters, so that cause either the intoxication or the withdrawal. So pathophysiology of the withdrawal, alcoholic withdrawal. In short, GABA receptor is the brake. If you think that the GABA is the brake and NMDA is an accelerator, what happens in the withdrawal situations? So the brain accelerating without the brakes. So there are no brakes, but more and more accelerator. So more and more apprehensions and without the GABA. So that is your alcoholic withdrawal symptoms. See the course of the alcoholic withdrawal. So what are all the symptoms you occur? Onset after the last drink. So tremors, maybe 6 to 36 hours after the last drink. Hallucinations, 12 to 48 hours. Seizures, maybe 6 to 48 hours. And delirium tremens, 48 to 96 hours. Tremors occur within 6 to 36 hours, secondary to the autonomic hyperactivity. So they are all the symptoms of these: tremor, anxiety, agitation, insomnia, anorexia, nausea, palpitations. And the signs, so you will have the increased heart rate, increased respiratory rate, increased pulse rate, and then increased blood pressure. So these are the signs. Hallucinations are very, very common in alcoholic withdrawal syndromes. They occur within 12 to 48 hours of the last drink. 3 to 10% of the cases develop the hallucinations. Duration is very much variable. Usually visual hallucinations, like the pink elephants. Occasionally auditory also, tactile or olfactory. So ethanolic hallucinations, reality testing is intact. Seizures, they occur within 6 to 48 hours of the last drink. 11 to 35% of the patients develop seizures in the hospital setting. Risk correlates with the duration of the alcoholic usage. Manifest as the grand mal tonic activity. Always rule out the other causes of the seizures. 40% of the single episodes, usually we don't treat with an anti-epileptics with a single seizure nowadays. Earlier we used to treat with anti-epileptic drugs for a minimum period of 2 to 4 years or 5 years with an anti-epileptic drugs. But now single seizure, so $1 million question: to treat or not to treat. 30% of the untreated patients go on to develop the delirium tremens. Ethanol is an independent risk factor for the seizures. A study of 308 patients in a city hospital with a new onset seizures during the ethanolic withdrawal. So this is a very common delirium tremens. It begins 3 to 5 days after the last drink. Occurs in less than the 5% of the withdrawal patients. Not always predictable or preventable. Usually lasts 2 to 3 days, but can last up to the 30 days. Delirium can occur with or without the tremens. The risk factors: acute concurrent medical illnesses, history of seizures of the delirium tremens, past history of the delirium tremens, heavier and the longer alcoholic history, elderly individuals more than the 60 years of the age group, elevated blood alcohol limits on admission greater than 300 milligrams per cent. So this is the delirium tremens. So confusion, disorientation, hallucinations, hyperresponsiveness, And if you see that the heart rate will be elevated, blood pressure will be elevated. So tachycardia and tachypnea and hypertension. Mortality is also very common with the delirium tremens. Without the treatment, about 20%, I think 40% they die without any treatment, maybe 80 or 90%. With the treatment, also 2 to 10% they are going to die. Causes of the death here is the aspiration pneumonia, maybe cirrhotics, severe hypotension, and a trauma to the spine and the brain. So the clinical assessment in the history, so presentation is very important. So whether the fellow is present to the hallucinations or delirium tremens or in the confusional state, what about the pulse rate, what about the heart blood pressure, respiratory rate. So these are all very important. And intake of the alcohol, whether it's the beer or the wine or the whiskey, what is the percentage of the alcohol in it, what is the volume of the alcohol he has taken, so what is the duration of the last drink, whether he has taken the food or the not. So these are all very, very important. History of the complicated withdrawal, use of the other substances. A lot of these people, they also take the benzodiazepines along with the alcohol. So your alprazolam or lorazepam or clonazepam. So they take along with these things. Some people, they take the cough syrups along with the alcohol, codeine especially. So the medical and psychiatric history, these are very important. Mental status, cognitive impairment, hallucinations, impulsivity, suicide risk or homicidal risk. So clinical assessment, so that vital signs, neurological examination, cardiovascular examination, abdomen examination. So all the exam, because it's a multi-system disease, alcoholic withdrawal signs. So dear postgraduates, so let us spend time on the differential diagnosis of the alcoholic withdrawal syndromes. See, it could be because of the acute to stimulant intoxication like cocaine, caffeine, methamphetamine, or in some cases of the sepsis, hyperthyroidism and thyrotoxicosis, heat stroke, severe hypoglycemia, intracranial process like trauma or cerebrovascular accidents, or encephalitis or metabolic encephalopathy. So the picture almost looks like an alcoholic withdrawal syndromes in these situations. So when you are in a doubt, so better to think of these conditions also. So before we label the case as the alcoholic withdrawal syndrome. So what are the indications for the admission? See, when there is a severe withdrawal symptoms, so better to admit the patient. And when the fellow presents the seizures or the delirium tremens, so definitely needs admission. Or a heavy and the prolonged alcoholic usage with very high degree of the tolerance, so better to admit the patient. And abuse of the multiple substances along with the alcohol and multiple substances, so drug addicts also we have to admit the patients. And concomitant psychiatric or the medical illnesses like comorbidities and psychiatric illnesses, so definitely needs the admission. And pregnancy is very precious, so definitely admit the patient. And lack of the reliable support network, we have to admit the patients for proper management. And what about the admission in the ICUs? So in the elderly patients and significant cardiac diseases, and when the fellows are hemodynamic instability and marked acid-base disturbances, respiratory diseases, serious infections, and active delirium tremens, so better to admit in the ICUs rather than in the wards or the rooms. And again, when the fellow is presented with a GI pathology, serious GI pathology like hematemesis or severe gastritis or acute hepatitis, etc., so better to admit in the GIT, ICUs, and the high temperature, rhabdomyolysis, acute kidney injury, and treatment of the recurrent withdrawal seizures. So definitely, when the fellow needs the IV benzodiazepine drip also, so better to admit in the ICUs only for the proper management and the usage of the other methods. And what about the treatment strategies? They include, we have to reduce the symptoms, so symptomatic relief, and prevent the seizures, prevent the delirium tremens, and prevent and manage the medical complications and the comorbidities. And support to care, so we have to ensure the ABCs, secure the patient in the safe environment, IV hydration therapy, correct the electrolyte imbalances, and provide good nutritional support. So these are all the support to care in in this population. And we have to give the reassurance to the patients, and we have to reorientation the program and monitor for the signs and symptoms of the withdrawals, and involve the psychiatrist and also psychologists to maintain and to assess the psychotic symptoms. Pharmacotherapy is very much needed to stabilize the psychological and the physiological withdrawal symptoms, to manage the medical emergencies, and sometimes non-life threatening and relapse triggering symptoms, and stabilize the comorbid conditions. So we need the pharmacotherapy. So thiamine and multivitamins are very efficient, because 30 to 80% of the patients are deficient of these things. Thiamine does not reduce the risk of the seizures or the delirium tremens, but it reduces the risk of the Wernicke's encephalopathy. Give thiamine in the dose of 50 to 100 milligrams IV. Administer the thiamine before, and then add the MVI injections after the thiamine injections. Benzodiazepines, they are very ideal for the management of withdrawal symptoms. They have the cross tolerance with the alcohol, the fairly wide therapeutic window compared to the barbiturates. And benzodiazepines, you have the short versus the long acting. Liver disease limits the use of the benzodiazepines because they damage the liver tissue. Short acting, they are the oxazepam and lorazepam is available. Advantages, they can be administered either IM or IV. They have no significant active metabolites. They are metabolized and excreted principally through the kidneys. They do not jeopardize already damaged the liver. And the disadvantage, they need to be administered more frequently because of the short acting drugs. Beta blockers and the clonidine, they reduce the autonomic hyperarousal like tachycardia, hypertension. They may reduce the total dosage of the benzodiazepines and result in the less sedation. They do not reduce the risk of the seizures or the delirium tremens. Other medications, carbamazepine can be used to reduce the risk of the seizures. They does little for the autonomic dysfunctions. They requires the monitoring of the complete blood picture. This includes the liver and the bone marrow toxicity. Antipsychotic agents can be used for the management of agitation, aggression, and psychotic symptoms. They can lower the seizure threshold. Other medications are best used as adjuvants instead of the substitutes for the benzodiazepines. See, these are the biomarkers of the alcohol toxicity. So ethanol level, draw the serum. It's a direct method. Minutes to the hours, and it depends on the amount consumed, usually within the hours. And if you check the ethyl glucuronide, so you can take the serum or the urine or the hair. These three can be tested to know the ethyl glucuronide in the serum or the urine or the hair. It's a direct test. 1 to 3 hours after the alcohol ingestion. And ethyl sulfate tested in the urine. Also whole blood or the plasma. It's a direct one. 1 to 3 hours after the alcohol ingestion. Phosphatidyl ethanol is the whole blood. A direct test. 50 grams of alcohol daily for the several weeks can be tested here. And gamma glutamate transferase is the serum. It's an indirect method. 60 grams for 3 to 6 weeks consumption must be there for the elevation of the gamma glutamate transferase. So time to the normalization of the abstinence is about 2 to 3 weeks. Carbohydrate deficient transferrin, again in the serum, it's the indirect test. Time to elevation takes minimum 1 week. And these two are the important drugs to be used, naltrexone and acamprostate. Naltrexone is the mu opioid receptor antagonist. Alcohol use disorder, the opioid use disorder. In both the conditions, you can use the naltrexone. Whereas acamprostate, you can use it in alcohol use disorders only. Clinical evidence, the reduced likelihood of the return to any of the heavy drinking, fewer drinking days overall, the reduced subjective experience of the craving, the decreased likelihood of returning to the drinking after achieving the abstinence, fewer drinking days, pre-treatment workup, check the hepatic function, the measure the serum creatinine, dosing, oral tablets, 50 milligrams per orally daily for the most of the cases. Naltrexone up to 100 milligrams daily for some population, and it can be used as the intramuscular injection also. Naltrexone, the potential side effect is the abdominal pain in about 11% of the patients, diarrhea, nausea, and dizziness in some population, whereas the accomplished diarrhea. Contraindications usually none in naltrexone, but accomplished is contraindicated in the CKD when the creatinine clearance is less than the 30. Special considerations: be cautious when using in the patients with acute hepatitis or the liver failure. Be abstinent from all opioids for about 7 to 14 days prior to taking the naltrexone to avoid the precipitated opioid withdrawal. May be preferable to a camprostate in patients with the comorbid alcohol and opioid use disorders. Now let us spend some time on the disulfiram mechanism of the action. It is an inhibitor of aldehyde dehydrogenase. When the patient consumes the alcohol while taking the disulfiram, the accumulation of the acetaldehyde causes a physical response such as tachycardia, flushing, headache, nausea, and vomiting. Indication is an alcohol use disorder. Increased likelihood of achieving the abstinence in patients for whom this is their goal. So in people who are motivated against the de-addiction, so definitely the disulfiram will help them a lot. And the pre-treatment workup, one should take the ECG, physical examination, and liver function tests. Dosing, first dose is about 12 hours after the last drink, and 500 milligrams each morning for about 1 to 2 weeks, then 250 milligrams morning times. So this is how we have to give the disulfiram. Side effects: the elevation in the hepatic enzymes, they are very common, and potentially fatal acute hepatotoxicity is also there, but it is a rare complication, rare side effect. Neuropathy and increased blood pressure in some population. Myocardial infarctions or the coronary artery disease or history of the seizure are the contraindications to use the disulfiram. Special considerations only for those seeking abstinence from the alcohol. Instruct not to consume the alcohol within 12 to 24 hours of taking the disulfiram. Recommend involving a family or the roommate as an observer of the daily medication adherence. Physical reaction can be precipitated by alcohol containing products like cold medicine or mouthwashes, and certain medications like sertraline, oral concentrate, or metronidazole or ritonavir. And another two drugs to be used in alcohol withdrawal syndromes are the topiramate and the gabapentin. Topiramate clinical evidence: reduction in the drinks for drinking day, reduction in the percentage of the heavy or any drinking days, reduction in the subjective experience of the craving. Gabapentin clinical evidence of the increased likelihood of abstinence from drinking and abstinence from the heavy drinking. Dosing between 200 to 300 milligrams daily. It is about 900 to 1800 milligrams daily. Potential side effects: short-term memory, dizziness, paresthesias, metabolic acidosis, and nephrolithiasis in the topiramate, whereas in the gabapentin, the dose-dependent sedation. Contraindications: renal impairment and severe renal impairment. So is the contraindications for the topiramate and the gabapentin. So disulfiram, already I told you all the things about the disulfiram. It's metabolized by the liver, inhibits the aldehyde dehydrogenase. Naltrexone is also a very important drug. It's an opioid antagonist. Acamprostate, it enhances the GABA reception and transmission. So the combinations, there is no additional benefit when the medications are combined. Topiramate, no differences compared to the other medications yet to add trials. So the gabapentin enhances the GABA activity. Baclofen, a placebo-controlled trial found in a large increase in the abstinence. Subsequent studies did confirm the efficacy. Antidepressants for patients with co-occurring depression and alcoholic usage disorders. So most of the people with the chronic alcoholics, so there may be the depression part, and these antidepressants take care of these things. And the certain drugs like sertraline, fluoxetine, imipramine. So they are very commonly used antidepressants in our practice. So let us spend some time on the cases. A 40-year-old married male, a businessman by profession, was brought by his family members to the emergency department with the complaints as below: a complete loss of the sleep, fearfulness, and suspicious talk since 2 days, poor intake of the food, disturbed sleep, tremors, restlessness, anxiety, and irritability since 1 week after reduction in the alcohol intake due to vomiting, and no history of the confusion and fever. History of alcohol consumption: a known case of alcohol consumption since 8 years with heavy drinking since last 2 years. Daily drinking morning since 1 year. 3 bottles of 180 ml per day, morning, evening, and the night. No past history of any seizures or delirium. No medical comorbidities. No psychiatric illnesses. No other substance dependence. No history of the past admissions. And there is a strong family history of alcohol dependence syndrome in the father. So the diagnosis is an alcohol withdrawal syndrome. Immediate treatment with the lorazepam injections and pantoprazole, thiamine, and other multivitamins. So the points to be remembered in this patient is an alcohol withdrawal syndrome, a symptom of insomnia, tremors, restlessness, tachycardia, nausea, vomiting, agitation, etc. So some patients, they also experience the paradoxical reactions. It is important to recognize this adverse effect and stop the drug. Chlordiazepoxide is a long-acting benzodiazepine that offers a smooth course of the treatment and less risk of the rebound symptoms. And another case, about 58-year-old male, complains since being off the alcohol for about 36 to 48 hours. And symptoms are seeing small insects around him, not seen by the others. So he is having the hallucinations, tremors, weakness, nausea, vomiting, sleep problems, and difficult to concentrate on the cravings. And alcohol consumption history, alcohol dependence for more than the 35 years. He is just 58-year-old right now. Binge drinking, Indian made foreign liquor, 375 to 750 ml per day for weeks to months on end, followed by a period of abstinence for a few weeks to months, and relapse later on context of minor stress or the boredom. Symptoms during abstinence: sleep problems, tremors of the hands, anxiety, irritability, nausea, retching and vomiting, etc. Cyclical urge for the drinks with binge periods often lasting for the entire day for the weeks. Mental status examination, is alert, conscious, cooperative, orientation with the time, place, and person, with poor self-care and the hygiene. Speech is relevant speech with a little slurring. No formal thought disorder, but was preoccupied with the thoughts of the craving. Locus of control is internal. Motivation, contemplation stage of the motivation. Perceptual disturbances in the form of visual hallucinations. Poor attention and the concentration. Judgment is adequate. The diagnosis is alcohol withdrawal syndrome. And the treatment, so we have to use the benzodiazepines, and also fixed dose regimen is highly effective and preferable in patients with these things. And another case, about 39-year-old male, married, engineer by profession, and brought by his wife with a history of alcohol consumption for more than 10 years, with multiple relapses and withdrawal seizures and history of alcoholism abuse. The chief complaints are disturbed sleep, tremors, tremulousness, restlessness, and past history of excessive consumption of the alcohol for more than 10 years. History of multiple admissions with 2 to 3 episodes of withdrawal seizures in the past few months. Attended alcohol anonymous groups. History of gastritis. History of alcoholism abuse. And a mental and behavioral disorder due to the use of the alcohol. See here the detoxification phase. Use the chlordiazepoxide. On the day 1, 25 milligrams 4 times a day. And the day 2, 3 times a day. And day 3, BD. And the day 4, 25 milligrams at the bedtime. And the day 5, 25 milligrams at the bedtime. So the long-acting benzodiazepines are the first choice of the treatment here. The withdrawal seizures are reduced by the long-acting benzodiazepines, and chlordiazepam oxide is the most effective one. And you will have the smoother withdrawal and the without the rebound symptoms. And another case, a 45-year-old businessman was admitted in the multi-specialty hospital with acute appendicitis. On the second day of the admission, he presented the various complaints. They are agitation, restlessness, anxiety, vomiting, insomnia, and craving for alcohol. Recently drinking heavily, more than 300 ml whiskey daily over the last few months, depression due to the business issues, and there was no past withdrawals. Patient was diagnosed with alcohol dependence syndrome with withdrawal uncomplicated. The symptom severity was moderate, and the patient had comorbid depression, moderate with somatic symptoms. So alcoholism plus depression. So here the treatment, chlordiazepam oxide, and maintenance treatment again chlordiazepam oxide 10 milligrams at the night. So in another case, about 37-year-old male with a history of alcohol dependence on the status epilepticus, presented to the hospital with 3 episodes of seizures and the background of the relapse of the alcoholism. The patient was admitted to the intensive care unit. So the presenting complaints, the 3 episodes of seizures, generalized, decreased sleep, and off the alcohol due to the religious ritual since the 2 days. Patient history, known alcohol dependent, drinks up to 360 ml of the alcohol daily, including daytime drinking, with refusal to go to work. Never stops alcohol. It develops seizures, confusion on stopping the alcohol. History of the status epilepticus is also there. So the diagnosis alcohol dependence syndrome with the complicated withdrawal convulsions. So the initial treatment chlordiazepam oxide 25 milligrams 6th hourly, and injection levetiracetam 500 milligrams, 2000 milligrams stat to control the convulsions, and DNS with the thiamine and the multivitamins. So long-acting benzodiazepines are the hallmark of the management of severe symptoms. So thank you very much for your patient hearing, and if you have any queries, I will be very happy to answer them. Thank you one and all.